Vaccine equity is vital to ending the pandemic. Here's why.
We will not be safe here at home until we're all safe globally.
As the pandemic surged across the globe, high-income countries pledged to donate roughly 2 billion COVID-19 vaccine doses to 190 countries, 92 of which are lower income. Foreign policy expert Kiefer Buckingham says vaccines need to be equitably distributed.
Right now, globally, the COVID-19 pandemic is not over. Unlike here in the United States, where a large amount of our population is vaccinated, globally, less than 10% of people in the lowest income countries have received just one dose of the vaccine. These vaccines prevent death and severe disease, but they can also prevent transmission. The longer a virus can circulate among a population, the more chance they have to mutate. And that's what we saw with Omicron. The only way we're going to get out of this pandemic is if we work together. But right now, the way that the vaccination rollout works, it's sort of every man for themselves.
For U.S. Marine Corps veteran Janessa Goldbeck, she understands it will take international cooperation to tackle the pandemic here at home.
We can't get our economy back up to speed. We can't continue with our lives and get our kids back to school if we keep having to deal with these pop-up new variants. And in order to get to that stage, the world needs to be vaccinated.
Africa faces one of the greatest global vaccination disparities, with the majority of the continent not even reaching 10% of their population being fully vaccinated. The World Health Organization called on countries to vaccinate at least 30% by the end of 2021, a target only 9 of the continent's 54 countries met. Rwanda received over 16.5 million doses as of January 27, 2022, as President Paul Kagame called on wealthier countries to do more.
As you do that, remember that there are those who have not had anything at all.
There are a number of reasons why the vaccine rollout has been inequitable. Unfortunately, the vast majority of those reasons don't actually have anything to do with the vaccine itself or anything like that, and most to do with political will. It has to do with wealthy countries coming in and hoarding the vaccine really early on. The United States was guilty of that, as were many other countries, taking many more vaccines than we actually needed, rather than making sure that they got out in an equitable way. So what's been difficult is lower income countries, lower and middle income countries are either competing in a market to get access to vaccines and paying for those, or they're getting them through a global organization called COVAX, which has worked to try to provide vaccines to low-income countries. But that's just been a drop in the bucket to what the actual amount of vaccines that these countries need.
Representative Raja Krishnamurthy is one of the lawmakers who introduced the NowThis Act, which would address global vaccination disparities.
I've offered legislation called the NowThis Act. It's a play on words, no more COVID, which would help to vaccinate 70% of the population of the world's 92 poorest countries. And I offered this legislation after 3 of my relatives died of the Delta variant in India in the late spring of 2021. And I pledged that I would do everything I could to essentially make sure that other people get vaccinated regardless of their economic status and certainly regardless of where they live.
The NowThis Act would allocate $34 billion in spending, part of which would be used to produce 8 billion vaccine doses and cover the cost of delivering those vaccines to other countries. They'd also create a global disease surveillance network to mitigate future pandemics. The NowThis Act aims to immunize 60% of the population in 92 COVAX countries who are eligible to receive the COVID-19 vaccine at no cost.
There's a big deficit between what is needed and what has been donated or pledged. And we need to close that gap immediately if we have any hope of ending this pandemic.
The End COVID Now campaign is encouraging people in the U.S. to contact the Biden administration and their lawmakers to fully fund the NowThis Act.
We know that 2022 is going to be a pivotal year in our fight against the pandemic. Do we get complacent and say, well, I'm just tired, I wish it were over? Or do we really double down? Do we redouble our efforts and finally say 2022 is going to be the last year that this is a crisis?